Welcome back to Living 808. It is a very difficult subject, but so important. In today's Sickness and in Health segment, we are talking about end-of-life planning. Joining me now, Dr. Sarah Canyon, who is with Adventist Health Castle. Hello, thank you so much for joining us.
Thank you so much for having me today, Trini.
Okay, I heard that you recently gave a public talk at Adventist Health Castle about this end-of-life issues, and the room was filled to capacity. Why do you think it was so important or so popular?
You know, Trini, 80% of chronically ill people wish to avoid a death in hospital. Yet 70% of people will die in a healthcare facility. The attendees told me that they had, by and large, witnessed a death that they themselves did not want to have in a healthcare facility. I think that's in part why it was an important topic, but also we have an aging population. And they're starting to wonder, wow, what do I do?
Okay, so that's really interesting. So people prefer to not to die in a healthcare facility, but you say that's kind of what's happening. People are seeing that people's wishes are not being listened to, and maybe that's kind of the interest. You think that's why a lot of people attended?
Well, you know, I'm not sure if it's that the wishes aren't being attended to as much as people aren't having a conversation with their families. So again, throwing some statistics out there, 90% of people when surveyed say talking about end-of-life planning with their loved ones is important, but we know only around 27% of people actually have that conversation.
Okay. And I can see, I mean, just, you know, it's an uncomfortable conversation to have. You know, why do you think people find it so difficult?
You know, I don't know exactly why, but I think people put it off. I think they think, oh, I have tomorrow, or I'm not very sick right now. I might be elderly, but I've been in very good health for a long time. I think that people aren't very comfortable because they might upset their children, their friends, their family, and they don't want to do that. Or if you're a daughter or a son, you don't want to upset mom or dad or auntie or uncle. So I think those are some of the reasons. That
was going to be my next question, is who should initiate that talk? You know, should it be the child? Should it be the parent? You know, what are your thoughts?
I think it could be either, and I think it's time we start to become more comfortable talking about these things with one another. Every conversation begins with a question, and anyone who's watching this today, I would encourage you, if you're not comfortable talking to your family members, then just get on the web. There's a lot of great information out there, a lot of great local information that can be accessed, and that might be a good way for people to start. The next option is that just start the conversation. Hey, what do you think? You know, I'm getting a little bit older. What do you think should happen? Or ask family and friends, what have they experienced? That's really where it starts.
Yeah, these are all very, very good tips. But again, it sounds like at the core, just having the conversation, having a conversation, right? Starting it is so important. And what exactly should people be discussing?
Well, you know, as well as talking about how you envision your end of life, where you want it to happen, what I would recommend is that every conversation should lead to one of two things. One, if you are over 18 years old, no matter what state of health you are in, you should look into getting an advanced care directive. There is a Hawaii State Advanced Care Directive that is very accessible online. That is a legal set of instructions that allows a person to specify their end-of-life wishes should they become severely ill or unable to speak for themselves because of illness. Number two, if you're the sort of person that's living with a medical condition or many medical conditions that really affect your day-to-day function and you feel yourself declining, or you could decline quickly if in hospital, then I recommend you talk to your PCP about doing a POLST, which is a medical order which reflects your end-of-life wishes that comes from your primary care doctor, is kept with your primary care doctor, and should be posted on your refrigerator.
Okay, very important. I'm sure I could talk to you for hours and hours because we're just kind of, you know, this is all surface stuff, but where can people get more information and maybe get some resources?
Well, if anyone wanted to talk to me personally, I'm easily accessible through Adventist Health Castle. My contact details are on their website through Search a Doctor. Alternatively, we still have some space in my repeat talk in September 13th at Castle Wellness Center. People do need to RSVP, and I know that seating is limited, so those are two options.